Hello, everybody. This is Dr. David Berger at Holistic ReLeaf in Tampa, Florida. We are doing something brand new today, which I am going to be conducting a video interview that we're going to be posting on this blog. Today, I am going to be speaking with Holley Moseley, who is the mother of a child with special needs who has made some incredible gains using medical cannabis, in particular CBD, with her child. She has written this wonderful book that I was able to get through in a very short period of time. It's a very easy read that you can see her called A Ray of Hope. RayAnn is her daughter. And she's going to tell us a little bit about RayAnn and tell us a little bit about her journey and what their experiences have been. So hello there. How are you today?
Hello, I'm great. Thank you for having me. I'm excited.
Absolutely, and hopefully this is going to go over well. Oh, I cannot minimize the Zoom when I'm recording. Okay, so, all right. So I would like for you to first of all tell me a little bit about RayAnn and how did she come to your life?
So I am a nurse and I was working here in Pensacola at Sacred Heart Children's Hospital. I was on the pediatric floor, and at the time there were 3 children who were waiting for a medical foster home, and RayAnn just happened to be one of them. She was my patient, and I had her for 3 shifts, so 3 days back to back. And I remember going home on that 3rd day and just praying for her and hoping that we can find a good foster home for her. She had a spark to her, and she captured my heart immediately. So not long after that, when I returned back for my next shift, she's still there. And so Christmas is approaching, and I just say to the caseworker, is there anything that we can do to give RayAnn a Christmas at home? Like, is there any way that my family could bring her home? And not sure what she was going to say, but she said, yeah, have you heard of non-relative placement? And so we pursued that, and within a few days, we were able to get all the paperwork done and, all the financials and everything that we needed to get done, and we're able to bring her home and give her a Christmas. So we knew that RayAnn had epilepsy and cerebral palsy, but honestly, we didn't know how much neglect and abuse had affected her diagnosis. And so I really thought that just with like a stable environment that we could get her caught up. I didn't quite understand what intractable epilepsy meant. And so we were on a hard road of highs and lows and hospitalizations and different medications and ER visits, and you name it, we experienced it. It was, for us, it took, I guess, all of these experiences to open our eyes to the idea that there's other treatments available. We had done all that modern medicine had to offer. We had her on 4 anti-seizure medications, and she was actually doing her worse than she's ever done. In a wheelchair, in a diaper, barely able to feed herself. Her quality of life was very minimal. And I followed her lead because I knew that there was more to her. I knew that there was just this person that was in there that we had to figure out a way to help her get out. And all the meds were just masking that. And so that's when we really kind of started looking to other treatments. What else is available that we can do? We looked at the epilepsy surgery. So we went to Miami Children's Hospital and had her evaluated for seizure surgery. And RayAnn was not a good candidate because she has multifocal points of her brain that are misfiring. So then we turned to, what about the ketogenic diet? And is that a realistic diet for our family? And, because it's a very strict diet. So we tried a modified Atkins diet and didn't see a lot of success with that. Took her then to kind of more of a holistic healer who said, let's try some different oils and let's try a gluten-free diet. It's hard to say because still she was on these other medications. So it's just hard to get a good picture. Then we, explored chiropractic care. I think that there was some success there for her with her gait and some other things, but still, we're still just searching. There's got to be something out there to provide relief and to improve her quality of life. And so that's when we saw the CNN documentary by Dr. Sanjay Gupta titled Weed. And my husband and I just sat there like in awe. You've got to be kidding me. Like, this little girl that we're watching on TV is just like RayAnn. And her family's trying cannabis. Like, I remember talking to our doctors about cannabis before, but we almost kind of laughed at the idea of it, and maybe this is something real. And so that's when it took us to Colorado to learn more. We were able to visit a nursery that it was being grown in. We were able to visit the laboratory that it was being processed in. We were able to meet other families who had relocated to have access to this high CBD, low THC oil. And they're all reporting tremendous results. Each of these families have our story. They have children who are medically complex. They've tried all there is that they can try. Their kids are maxed out on medications. They're trying to find relief. And they're finding it. They're able to wean off some of their seizure drugs, and their child's responding well to the high CBD oil. And so we want this for RayAnn. We have to get this for RayAnn. And so we have options. We can relocate, move our family to Colorado, or we can fight for it to become a possibility for patients in Florida. And so that's when we were connected with Representative Matt Gaetz. And he invited us to a rulemaking workshop in Tallahassee, and we shared our story. And there were other families there who were sharing their stories and all asking, don't discredit our child because of our zip code. Allow us to have the same opportunity that the children in Colorado and elsewhere are having to at least try this treatment. And so at the time, we were asking for the high CBD, low THC oil to become legal. And somehow with compassion, I honestly believe, and just some education, the Compassionate Medical Cannabis Act passed in 2014, and Governor Scott signed it into law. And so that was a momentous event for us and for all patients in the state of Florida. Wasn't quite time to jump up and down and shout from the rooftops, because we didn't quite understand that then the rulemaking process was going to begin. And so it was still going to take some time for patients to actually get their hands on this and to be able to try it. And so during that time, we were lucky to come across physicians who were educating themselves as well on this as a potential therapy. And we seeked those physicians, and the one that we were meeting with was the one who really kind of pushed me to begin. RayAnn was hitting puberty and her seizures were increasing, and it was just becoming evident that she was going to have a really hard time. And so he's kind of was like, what are you waiting for? You advocated for this law. It's law. Do what you have to do for your child to make it a possibility. And so that's what we did. And we started RayAnn on high CBD oil on September 19th of 2015. Started at a very, low dose. We worked with a neurologist, and he helped us wean her up to or titrate her up to an acceptable dose where we started seeing some real results. And I just want to stress to families, it's not an immediate, with your first dose, your seizures or all of your problems go away. It took time. I would say within the first week, we started seeing some small changes, things that I kind of was like, oh, are we going crazy? But just, things like she wasn't drooling as severe. She wasn't falling as much. Her eyes seemed to be clear, and she just seemed to be a little bit more cognitive awareness. And then family members were starting to notice something's different about RayAnn. And we're like, yeah, well, this is why. And then, you know, until like a month into it, we started realizing, hey, we're having seizure-free days. And so all this time I'm taking really diligent notes. I'm documenting everything. I'm trying to follow is this real? Is this really happening? And, you know, it took us some time before we started having seizure-free weeks and seizure-free months, but with just diligence and patience, it did come. And all along, I'm working with a neurologist, and then he also says, okay, it's time to consider weaning off some of her pharmaceuticals. And that's what we did. Weaning off, for instance, RayAnn was on clonazepam. Weaning off a medication like that she had been on for over 7 years was a very hard process. We saw a lot of behavior outbursts and such. So again, it just took diligence and patience to get through that. And I'm happy to say that RayAnn is now over 2 years seizure-free, and she's completely weaned off her clonazepam and almost completely weaned off her last seizure drug, down to just a very itty-bitty dose. And again, we're just taking our time with that. She is making huge gains at school. Her teachers before would text me or call me, you know, RayAnn had a fall, or RayAnn had, you know, severe seizures, or RayAnn's sleeping, something's not quite right. But now I get phone calls. We are so proud of her. She has matured so much. You'll never believe what she did at school today. She completed her whole math worksheet on her own, or, you know, her handwriting has improved. Things that we just never thought would be possible are happening for her. So it has been a journey, but it has been a journey that has been 100% worth it. And I wouldn't change it for the world, because it's brought us here. And now we feel like it's been kind of placed on our heart to share our story, and in the hopes that we're able to inspire and help other patients and other families. Looking back, I wish this is something that had been available to her from the beginning. And, you know, unfortunately, it just not how it played out for her. But I hope that, you know, other patients and families will consider this for their children early on as a treatment option, because it is something we can't ignore, because it is medicine and it is truly helping so many patients.
Yeah, that's wonderful. And it's so inspiring to hear the types of stories, you know, in my clinic where I, you know, get to spend relatively short periods of time with people. But as we see them back every 7 months, and we really start to hear these types of stories, that it's kind of like, while I'm excited to hear these types of stories, I'm no longer surprised, because, you know, we hear people weaning off of their medications, whether it's their seizure medicines or their antidepressant medicines or their pain medications. In fact, it's probably one of the most common, quote unquote, side effects that I see from medical cannabis is the reduction of other medications, of which almost all of them are typically more challenging and toxic for people than what this is. So that's very exciting to hear. Now, tell me, prior to getting into this and learning what you did, what, you know, as a typical parent, what was your knowledge and your opinion about cannabis prior to having RayAnn be brought to your life?
Great question. So in nursing school, we learned that cannabis is a gateway drug, you know, to stay away from it. So I, you know, maybe didn't have the best opinion of it. 100% it just took being in our situation to see the medications that I was giving her, to see the side effects that they were having, and to be able to look outside of that and consider something different. And once I did the education and I truly, you know, began to learn about the endocannabinoid system, and began to talk to other patients who were having positive effects, that is what helped open my mind to consider this as a form of treatment. And again, I'm so very thankful that we did that, because look where we are today.
That's fantastic. That's fantastic. And once you had seen the Dr. Gupta's video, his show, how much time did it take, and what was your path then from just recognizing, hey, this is an interesting thing, to, hey, we really need to try this? Tell me a little bit about like what that was for you, and in talking to the other doctors and family members. There's obviously lots of people who have lots of opinions about this. So maybe tell me a little bit about like that little transition period for you.
Yeah. So the first thing we wanted to do is go out there and see, is this real? And so that's what we did. Like I said, we were able to go visit the nurseries and the labs out in Colorado, meet the other families. Then we had to decide, are we going to relocate our family and go out there? Or, it's just not that easy when you have a medically complex child to just uproot your family. We had such a large support system here. Then the next step also was to talk to her neurologist and get his opinion. What are your thoughts on this? And I'm so thankful that he was just honest. He said, I don't know, but let me look into it. And that's what he did. And he came back to us and he was like 100% believe this is something that RayAnn should try. And so then, I think once we got to Tallahassee and we began sharing our story and we began to see the minds of the senators and the representatives change and meet other families who are also counting on this in Florida, that really kind of stole our heart, and we decided to stay in Florida and make it a reality. And luckily the bill passed the first try. And like I said, we still had to wait for the rules and regulations and things like that to happen. But everything happened how it was supposed to, I believe, and it just made it easy to follow, the next step. So yeah.
That's great. Now, you mentioned in terms of what you're a neurologist, were there any other physicians or family members that were naysayers?
Living in conservative Northwest Florida, honestly, none of our close family members, they had been on this path with us. They knew that what we had tried with RayAnn, they knew that we had to try something different. Her pediatrician was okay. She didn't necessarily say no. She didn't necessarily say 100%. She was just open to that might be the next step. Yes, the neurologist ended up being very supportive. We maybe had a few people that we would run into in the grocery store, community members who knew us, who knew RayAnn, and maybe had opinions. And they would stop me and say, I can't 100% support what you're doing. And that was okay. I listened and I just shared. And usually by the end of our conversation, they would come around and say, okay, I get it. Once I explained that the medications that I'm giving RayAnn right now are way worse than what I'm trying to give her. Our goal all along has been to improve her quality of life, and everyone in our community knows her and loves her. And, they know that once they heard it from us, that it was pure, and that's 100% what we were trying to do. And so they came around. But yeah, we were lucky. I mean, we had people on Facebook who would text message us and say, you guys are terrible. I can't believe you're considering doing this to your child. I'm calling DCF on you. And, that was hard, but at the same, that really hit my husband hard. But at the same time, I knew that what we were doing, and we were doing it for the right reasons. We had put the education in to understanding it. And I just felt like this was what we were supposed to be doing. So I didn't let any of it affect us.
That's fantastic. The instincts of parents, even when when a child's not genetically related, it's just absolutely amazing that when a child hits your heart and you're living with them and you're kind of going through that whole process of trying to figure it out, that the instincts are just a wonderful thing that, I really encourage all of my patients to really listen to their instincts, whether it's something that they even dream about or something comes to them in meditation or divine intervention, that those are very often, and although one can't scientifically explain those types of things, but they're usually spot on. In fact, throughout all these years of working with special needs children, some of the absolute greatest breakthroughs that I found not medical cannabis related has almost very consistently been something that the parents have found. So that's amazing that you were able to come to that discovery. So, in the way that you did. Now, one of the things that you also discussed in your book, which I really found quite compelling, was your how to build the best team for your child. I'd like for you to share with us a little bit about that. As I was reading through this, a lot of the advice that you give is advice that I very often, like I almost felt like I was reading some of my own writing here, like this in terms of the filtering process and then taking a village and there are a lot of those things. It was just kind of like, wow, I could have written that chapter right there. So, could you share with us a little bit about the how you build the best team, and like if you have any little guidelines or tips for families?
Yeah. So I love that you just said that, by the way, because every time I talk to a mom, I tell her that follow your gut. You know your kid the best, follow your gut, follow your instincts. And so I love that you just said that as a physician, because I think that's really important for physicians to encourage parents as well. And that kind of ties into building your team, because the parent needs to be the team leader. We spend the most time with our children. We know all of their little quirks and what may be a seizure and what isn't a seizure and so forth. And in doing so, we need to be educated at the same time, though. So I sat down and I learned as much as I could about epilepsy. And then I learned as much as I can about epilepsy for RayAnn. What did her epilepsy mean? And so I just think it's very important for the parents to become educated, to understand that they're the team leader, and then to around them build a really solid support system. Start with a really strong pediatrician, a pediatrician that you can go to, that you trust, that gives you her cell phone number, and that you just have a really honest relationship with. This is a child who's medically complex. This isn't just a healthy child. This is a child that you're going to need the pediatrician more often, and then start looking at specialists. And again, for medically complex children, we have many specialists. And so you as the team leader are going to be responsible for relaying, well, this doc told me to do this, and making sure everyone is on the same page. And I really think, like, for instance, RayAnn, a child who has intractable epilepsy, who has tried numerous anti-seizure drugs, and that's all that our local community could offer, that we needed to go to a university and look at what other options are available to her. So that's really important, again, and then to find a specialist who you can trust. That's beyond important, to be able to have an honest relationship. They challenge you and you challenge them. And then to don't give up when you hear no. And there were so many times that, we were told, no, I don't think that's a good idea. But follow that gut instinct. If you think it is, push it. And don't be afraid to get a second or third or so forth opinion. It's okay. You're not trying to hurt anyone's feelings or egos, but to again, follow your gut, to do what's right for your kid, and to keep going until you get what feels right, the answers that you need for your child. And then I always encourage parents to be prepared for their doctor's appointments. As the team leader, you need to come prepared, especially when you have a medically complex child. I can't remember how many times RayAnn had a seizure there in the doctor's office, and then everything that I thought we were going to talk about for the appointment ended up going out the window. So come prepared to the appointment, have notes, bring a person with you if you need to, and take notes. Those are just some tips that I learned along the way. So I hope these help. Again, for us, we were so lucky because also on our team, I need feedback from teachers. I need feedback from physical therapists. We all have to work together to do what's best for RayAnn. And so we were so lucky that, her teachers were on board with anything and everything that we were trying and were supportive, and that I had a pediatrician who would talk with our physical therapist and say, let's try this. So just building that strong team for your child is going to help them be most successful as possible.
Good. Now, I did happen to notice that you did leave one part off of your what you listed to me, which of course, being a mom, I realized that this would be the one that most moms do forget about, but which is to find someone to support you too. And which I think is such an incredibly important thing because, you know, as parents, obviously, when it comes to our kids, we wear our hearts on our sleeves. And when things are going rough, we have to be the foundation for everybody else. Yet who's watching out for us? Who's giving us the care for us that, you know, in order to kind of be able to fight on through. And so even though you didn't mention it, I wanted to bring that out because I think that that's an incredibly important thing. We know that, you know, with special needs children, how often that can actually split apart families, that, you know, we know divorce rates are even higher in the special needs population. And, you know, it's very easy to neglect ourselves. And I think it's very important, whether it's making sure that you have an occasional date night or a girls' night out, guys' night out type of thing, where we need to have those types of things to recharge ourselves. We can't be 24/7 in this and think that nothing else in our life is going to suffer as a result of that. So I do also think that that's a really important thing because, as you kind of mentioned here at the end, by you supporting yourself, you're going to help your child and you're going to help your other children who can certainly feel neglected, you know, when there's so much effort being put towards a special needs child, and making sure that those other children are taken care of. So often an older sibling or even sometimes a younger sibling ends up becoming another caregiver to that child and kind of loses some of that innocence and kind of takes on some parental roles. And it's wonderful that they're willing to do that, but that can also even strip them of their childhood somewhat. And so putting all, you know, we've always spelled holistic with a W around here for a very real reason, which is you have to look at the whole picture. And I think that you did a really fantastic job, both in terms of your approach to your family, but also with this wonderful gift of a book that you've shared with all of us. And so I would like to encourage everybody. It's available on Amazon.com. It's called The Ray of Hope. And you can pick it up from Holley. It's Moseley, Moseley, and it's a fantastic book. It's a really easy book to go through, and I would encourage everybody to get it. So thank you so much. You are an absolute hero of our community. You have done so much. You know, I've been following along and knowing what you and Peyton have been doing for many years now, and certainly you deserve a plaque on the Hall of Fame for what you've done for the entire medical cannabis community in the state of Florida. I don't know how far we would have gotten without you, so thank you.
Oh, that's very kind, Dr. Berger. Thank you.
Absolutely. Well, have a nice day, everybody. Hopefully this was just the first of others and many that we will be doing of this video blog series. And by all means, please feel free to leave us comments or if you have any questions, and have a great day.